The thoracic spine is built for rigidity. The ribs connect to the sternum and the spine to create sturdiness around your visceral organs and protect them from injury. Because of this fact, when we are investigating or treating with repeated thoracic extension and sitting, it's not uncommon to need quite a bit of force. So for thoracic extension and sitting, I want people to have a chair that hits them somewhere in the mid-back. If we need to get really picky about the height of the chair, we can. Of course, if the chair is too high, I can have people sit on books or pillows to increase their height in the chair. But there are many ways to get overpressure to increase the amount of force versus just extending over the chair. One way is to add a fulcrum. I use a small ball. You could also use not only just a small soccer ball or volleyball, a football. You can use various other things that, unlike the chair, will hit you at a very specific part of the thoracic spine. So I've said before that I treat macro before I treat micro, and that applies here as well. If it's really important where this ball is hitting, for example, T8 versus T10 or T5, then we can play around with the height of the ball or the fulcrum and see where it's most beneficial. But for most people, if I put this somewhere in the upper to mid thoracic spine where I think it's going to help them increase the force, then that's sufficient enough, kind of just thinking about the mid, upper, and lower thoracic spine more generally. So for this procedure, which can be, of course, a test when we do it repeatedly, when we take all of our baselines, we do thoracic extension repeatedly in sitting, possibly with pressure, and then we retest. We use it as a test. We can also use it as treatment once we've confirmed that it's the right thing to do. Then I just have people sit with their backs to the chair, place the ball in the thoracic spine, and then go all the way over. Typically, I'm having people place their arms like this. People can also brace their head if they need to provide some support to their neck. Sometimes I have patients do this, especially if their biceps are too big and they can't get their hands back there. But just keep in mind that for most thoracic spine investigation and treatments, we are adding a decent amount of force. Other than the ball, I can use my hand and apply overpressure as a clinician. I can also mobilize the patient, adding even more force in this position. But I'm not shy about using force in the thoracic spine given its rigidity. And one crucial way of doing this is sitting and extending this thoracic spine over the fulcrum of the chair, but also adding a little bit of force.